Hi everyone, I'm Dr. Vasanth Kumar Gourani. Yes, once again with one more case. This is the third case I'm showing to you. After NS1 positive on second day, it is not that after 5 days. On the second day, NS1 positive, and this case IgM and IgG was not noticed at the end of the treatment after 6 days. Basically, when there is a NS1 positive, on the early days, 2,94,000 was the platelet count. After 2 days, 1.5 day, it has went to 3 lakhs 4,000. It's a only 4-year-old child. Only 4 years old child. Then after 3 days, it has went up to 4 lakhs 13,000. There is no fall. If you come early diagnosis, early treatment, what I want to say is the best treatment and never a problem arises like admission or a transfusion of blood, hospitalization. This doesn't happen at all in all my cases. So the thing is, every doctor has to notice one thing is why there is no IgM and IgG antibodies, because the virus is killed as early as possible so that there won't be any IgG and IgM. If it is delayed after 5 days or 6 days, definitely IgM comes and IgG will continue persist for a long time. Whereas my treatment concerned, in all my cases, the platelet count will increase, the cytokine storm will wash out, and there won't be any fever. 100% in all the cases, 12 to 24 hours, within 12 to 24 hours, there won't be any fever. The weakness, basically, the weakness depends upon the diet which you give it to the patient. Most of the people, when they join the corporate hospital, they won't get any diet at all because they give us the dal and the rice and the curd. This is not enough for in all the dengue cases. They need any good diet, good things, good medicine, and they don't have this medicine. What I give to the patient, they don't give it to the patient. It is not that antibiotics will treat the patient in the dengue. Zero role of antibiotics. Whereas the ORS and uh, the hydration, what they say, it's needed for all the cases in the fever cases, not with the dengue. So keep it aside. And they say to eat you the papaya leaves, papaya fruit, kiwi fruit, and some other. I don't think so. This will give some boost or anything else. There is useless things, I can say that, because of the kiwi fruit and all the things. Again, you will be vomiting, and again you will be losing the energy in that cases. This is what happens in the treatment of those people. Even some people give the steroids too in this dengue, but it is not needed in this dengue at all. I request the people, this is the best treatment. I use some multivitamins, I use the medicine that to kill the virus, I use the food high rich protein. So this all gives me an 100%, so that the platelets start increasing all the time. That's his got. See, when the virus is there for 5 days to 6 days, when NS1 is positive, so the virus kills the platelets by consuming all the platelets. So platelet drop will be there. Then afterwards, autoantibodies against the system, which is there, the autoantibodies, that is IgG or IgM, that again acts on the own platelets. So the destruction of the platelets again. So there is a fall of platelets later on in some of the cases. So most of my things is to kill the virus. Second, stabilizing the thing, removing the cytokine storm in the people so that the people will come in faster way. Just in a 4 days, all the weakness will go off, and the children can go to school, and the elders can go to their jobs and everything, and they can do all the activities. There is no issue. There's some if some people takes the treatment outside the any big corporate hospital or any place, they will be weak for 1 month or 2 months, and there is a lot of issues in that one because the clots are forming, the D dimer level increases, the vessels are damaged, the liver is damaged, and some people face a headache or two. So these all things never happens in all my cases of COVID, dengue. You all know that I had treated the COVID. in just 4 days in the world. And this is the best of treatment for the COVID, which I have treated with the different medicine, dengue with different medicine, chikungunya with different medicine. In all the cases, which I had put place it to the ICM or Delhi, but still I could not get the recognition or whatever the things are there. I just request all the people. This dengue will not kill. This dengue will not make you to the admit in the hospital, ICU, transfusion of blood or ventilator and all the things. You can escape from this one with only my treatment. It's only my treatment which gives an 100%. It is fruitful. It is just a medicine that kills the virus. So I request all the people to share this video to all the needy people who have been infected with the dengue. The whole the system today we see, they will be fighting with the mosquito. It's not the mosquito. If you kill the virus in the person, if the mosquito bites to the non-infected people also, it will not spread. If you don't kill the virus in the people, then it is gone spreading for the long time in their house and different houses too, and different people too. So I request this video should be shared to so many people so that they can escape from this killer dengue virus, because so many, we noticed around 10,000 cases last year. If it will be more, because it is only the government statistics that is 10,000, and you will be seeing that 10 times or 20 times which has been there in the community, because most of the private labs, private hospitals will not be registered these dengue cases to government. I request to share to all the people. Thank you.